Pantoprazole injection is a proton pump inhibitor, PPI, used primarily for the treatment of conditions associated with excessive gastric acid production. It is administered intravenously when oral administration is not feasible. Pantoprazole works by selectively inhibiting the hydrogen potassium ATPase enzyme system in the gastric parietal cells, which reduces the production of gastric acid. It is commonly prescribed for conditions such as gastroesophageal reflux disease, GERD, Zolin-Relison syndrome, peptic ulcer disease, and stress-related mucosal damage in critically ill patients. The mechanism of action of pantoprazole involves irreversible binding to the proton pump in the gastric parietal cells, leading to prolonged inhibition of acid secretion. This effect helps in healing erosive esophagitis, preventing complications of acid reflux, and managing hypersecretory conditions. The pharmacokinetics of pantoprazole indicate rapid absorption and distribution when given intravenously, with peak plasma concentrations achieved within minutes. The drug is extensively metabolized in the liver, primarily by the cytochrome P450 enzyme system, and is excreted mainly in the urine, with a smaller proportion eliminated via the bile. Pantoprazole injection is indicated for short-term use in patients with erosive esophagitis due to GERD when oral therapy is not appropriate. It is also used to treat pathological hypersecretory conditions, including Zolin-Relison syndrome. In hospitalized patients, it is often administered to prevent stress ulcers and upper gastrointestinal bleeding, particularly in those who are critically ill or on prolonged mechanical ventilation. The usual adult dosage of pantoprazole injection is 40 mg once daily, given as an intravenous infusion over 15 minutes. For Zolin-Relison syndrome and other hypersecretory conditions, higher doses may be required, with adjustments based on the patient's acid output. The duration of intravenous therapy is typically short, with a transition to oral therapy once the patient can tolerate oral medication. The safety and efficacy of pantoprazole injection in pediatric patients have not been well established, and its use in this population should be based on clinical judgment. Pantoprazole is generally well tolerated, but some patients may experience side effects. Common adverse reactions include headache, diarrhea, nausea, vomiting, and abdominal pain. More serious but less common effects include an increased risk of Clostridium difficile-associated diarrhea, vitamin B12 deficiency with long-term use, hypomansemia, and potential kidney damage. Rare but serious side effects include severe hypersensitivity reactions such as anaphylaxis and Stevens-Johnson syndrome. Prolonged use of proton pump inhibitors, including pantoprazole, has been associated with an increased risk of bone fractures, particularly in the hip, wrist, and spine. This is thought to be due to decreased calcium absorption secondary to reduced stomach acid. Patients who require long-term therapy should be monitored for bone health and may need calcium and vitamin D supplementation. Additionally, there is evidence suggesting that long-term PPI use may increase the risk of gastric polyps and, rarely, gastric malignancies. Pantoprazole has several drug interactions that need to be considered before administration. Because it affects gastric pH, it can alter the absorption of drugs that require an acidic environment, such as ketoconazole and atazanavir. It may also interfere with the metabolism of certain drugs processed by the cytochrome P450 system, including warfarin, clopidogrel, and methotrexate. When given concomitantly with warfarin, there is a potential for increased bleeding risk, necessitating closer monitoring of INR levels. Pantoprazole can also reduce the effectiveness of clopidogrel by inhibiting the CYP2C19 enzyme, which is necessary for the activation of clopidogrel, leading to concerns about reduced antiplatelet activity in patients with cardiovascular disease. The contraindications for pantoprazole injection include known hypersensitivity to pantoprazole or other PPIs. Patients with a history of severe allergic reactions to PPIs should avoid its use. It should also be used with caution in patients with severe liver disease, as hepatic impairment can alter drug metabolism and increase systemic exposure. Dose adjustments may be necessary in such cases. Pantoprazole is classified as a pregnancy Category B drug by the FDA, meaning that animal studies have not shown harmful effects on the fetus, but adequate human